So before we get started and start to talk more about the reproductive psych program, would you mind talking a little bit more about you and your background to get acquainted?
Of course, yeah. So I'm Sinmi Bamgbose, a psychiatrist and a reproductive psychiatrist. And let's see, I have been working here at Mindful Health Solutions for about a year and a half now. And I started in reproductive psychiatry. So actually, back in medical school, I was very interested in OBGYN and thought that working with pregnant patients and postpartum and all the gynecological issues was really interesting. And then didn't want to be an OBGYN though and was really drawn to psychiatry. And in residency is when I met another reproductive psychiatrist, one of my mentors, and found out that I could spend all this time working with OBGYNs and working with the common complaints that they manage, but as a psychiatrist. So I was like, oh, perfect. I'm going to do that. And here we are.
Yeah, that's great. And it sounds like with all of your experience with reproductive psychiatry, I know it's not as talked about as other types. So in your opinion, like why reproductive psychiatry? Like why should people know more about this
Oh, yeah.
specifically?
Well, it's really, I would say, these are issues that affect about 50% of the population, right? So
Mhm.
hormonal reproductive psychiatry really talks about hormonal changes. So it's like fluctuations that have to do with the menstrual cycle, which can include premenstrual dysphoric disorder, PCOS, also endometriosis even, and then pregnancy and things associated with pregnancy. So infertility in the postpartum period, all the way through menopause as well. So 50% of the population are going through these hormonal changes at various times in their life, and they can exacerbate depression, anxiety, bipolar disorder, ADHD, things that people already have. And then they can also cause those things if somebody didn't already have them. So I think we have to care about it because it's really prevalent, but we just don't talk about it as not a lot.
Yeah, it is such a big thing to be, experienced by 50% of the population and not be like common knowledge for everyone.
Yeah, totally.
Um, Crazy. We wanted to touch specifically on PMDD and talk about that a little bit more and just starting off with, what is it and how is it different from PMS and how that usually
Mhm.
acts.
Yeah. So PMS is pretty common. It affects about probably, many women or people who menstruate will experience PMS, and that involves physical symptoms like bloating, fatigue, cramps, headache, all those things we associate, and also some minor irritability, mood changes, that kind of thing. It's pretty mild. It doesn't really usually prevent people from working or going to school or interacting and living their lives.
Mhm.
PMDD is a pretty severe form of PMS, so it's a step above, and that stands for premenstrual dysphoric disorder. So it's in the 7 to 14 days before somebody's period starts, where they're going to experience like severe anxiety, severe depression, like really a lot of irritability or mood swings. Like sometimes people experience suicidal thoughts. They can't go to work, they can't go to school, they find themselves getting in fights with family members, like their sleep is disrupted. So just it really affects their ability to function. And then their period starts and they feel better. And it's just like a flip of a switch.
Right.
So if somebody's experiencing that really significant change in how they feel the 2 weeks before their period to after their period starts, then they're likely suffering from PMDD.
Is there anything specific that causes PMDD to start taking place instead of just normal PMS?
So that hasn't been totally elucidated yet. So there are
Mhm.
some studies that show that for people who menstruate, they likely have some difference to sensitivity in the way that the hormones, the progesterone and estrogen, the way that the changes that everyone who menstruates has in a cycle, but it affects their body differently. So it's not about like the absolute level. So unfortunately, there's not a blood test we can take that could say, okay, you're going to get PMDD, but it's just about how your body reacts to those changes. Um, so that's what makes it a little bit more different.
Yeah, and that sounds like a sort of thing that would be a lot harder to diagnose, and like a lot easier to be missed if you're not specifically looking for it. What does that process usually look like when you're talking to patients and sort of like figuring out what's going on?
Mhm. Yeah, I think a lot of people have been misdiagnosed or they've been told it's just PMS for so long. So they're kind of just their symptoms are poo-pooed. So a lot of the people that I see have come in and they've been doing a lot of research and they'll say, I think I have this. So
Mm,
unfortunately, it means this is someone who's been suffering for years and years, and then they've done all their online research. So it is easy to be missed, especially with providers who are not well versed in period health and women's mental health because they kind of just think, oh, well, it's just PMS. You'll get over it. Just take a couple of ibuprofen and you'll be fine. So when people come in and they tell me, I always ask, when they say, sometimes I feel really upset, I get really anxious or sad, and I'll ask them, when is this happening? Do you notice that it has any correlation with your cycle? Do you notice that when your period starts, you feel better, or those 2 weeks before? So if it's somebody who hasn't already done the research before they come in to see me, they'll say, oh, you're right, I do notice it, or I'm not exactly sure. And then we can do a symptom tracker. Well, there's tons of symptom trackers online, and you can go through your symptoms and see, oh, wow, I'm really noticing that in that week before my period, I feel terrible, and then I feel better.
mhm. Yeah, that makes total sense. So when you do figure out that kind of thing, how do you go forward with treating it? What does that usually look like?
So, treatment is there's a wide variety of treatments, and it's not a one size fits all approach. And definitely
Mm,
the first thing is to really consider a person's history. So, premenstrual dysphoric disorder is, of course, associated with people who also have depression and anxiety, and in some cases, bipolar disorder. So, it affects the options that are available to them. Often the first line is actually some of the antidepressant medications, the SSRIs. So like Prozac, Lexapro, Zoloft are some of the common ones. And a lot of people will just take that in the 1 to 2 weeks before their cycle starts. Interestingly, the way that these antidepressants work is they modify one of the progesterone hormones in the body and affect the way that the body is responding to that hormone. So in a slightly different way than how antidepressants usually work. Some people, for example, some people with a history of bipolar disorder or people who don't tolerate SSRIs, that's not going to be an option for them. So then they might want to go to hormonal contraceptives because they tend to keep the level of hormones consistent throughout the cycle as opposed to the up and down that happens with a typical cycle. So they suppress ovulation and the person doesn't have to deal with the fluctuations and hormonal changes. Of course, there are some people who can't take hormonal medications for various reasons because of their side effect profile, or they themselves can have effect on mood. So then other options could be supplements, like calcium supplements are helpful. Chasteberry has had some evidence in being effective for PMDD. Magnesium as well can be helpful. Exercise, a good diet is something that is generally good for most people, but in this situation can be really helpful. Um, and then for other people who aren't really responding to any of that, sometimes we'll use more third line, like mood stabilizing medications, the antipsychotics or other mood stabilizers, just to see if they help with those really severe symptoms in those couple of weeks before the period starts.
yeah, that's really interesting. Out of my own curiosity to go back to, taking antidepressants for something like this, you said that you're taking it like the 2 weeks before your period
Yeah,
starts, like just during that time frame. So how does like what does that usually look like? Because I know a lot of antidepressants take like at least a week to actually
yeah.
start to like work and start to have side effects, and then if you stop them, they like get weird. So like what does that specifically look like if you're just taking
Yeah.
them in that time frame?
Yeah, it's a really good question because that is the case. So when the normal antidepressants work, it has to do with like affecting the level of serotonin that's happening in the long term and receptors. But
Mhm.
because they also work on modifying the progesterone hormone and the way that it's responded to in the body, that actually works quite quickly. So
Okay.
I will prescribe super low doses or a low dose for that 1 to 2 weeks. So it starts to work pretty quickly. And then when they stop it, it doesn't have that significant withdrawal effect that you might have if you've been taking a higher dose for a long time. There are some people who end up taking the antidepressant around the whole month long.
Mhm.
Sometimes they'll take a regular dose, maybe a low dose through a month because they already have depression or anxiety. And then in that 1 to 2 weeks before their period, they might bump it up and add that extra like buffer against for support there, and then go back down to their regular dose. So there's definitely lots of different ways to finesse it.
Yeah, that's really cool. That's interesting to know that you can kind of like finagle how you
Mhm.
actually use them and not just
Yeah,
like
I
standard.
know. Yeah, it is really
Um,
interesting.
that is really cool. What would be your general like baseline tips for someone that is dealing with PMDD and isn't really quite sure what to do?
Well, I think definitely the first thing is to make sure that all medical things have been ruled out because, just to make sure that your thyroid is okay and talk to your doctor about if there's any other physical thing like endometriosis or any other um, gynecological disease that's going on that could be exacerbating what you're feeling. And then having a therapist ideally would be wonderful, someone that you trust, you can really talk to about what you're going through, like the feelings
Mhm.
that you're experiencing. And then keeping a symptom tracker, sometimes even just knowing like, okay, today is day 14, and I know that usually I start to feel bad around day 14, and trying to make sure that you do things that you like plan a movie night or whatever that you can tolerate that feels good for you. So some of those behavioral lifestyle changes. But then seeing a psychiatrist who has some familiarity with the diagnosis of PMDD is probably going to be really helpful. A psychiatrist, a nurse practitioner, or an OBGYN, right?
Right.
Because if they have familiarity with it, then they can walk you through the different steps.
Yeah, that's really great.
Yeah.
Sort of to navigate back into just general reproductive psychiatry. So if you were going to give us just like the highlights of the program and what you're sort of doing, would you be able to run through that again for us?
Sure. Yeah, of course. I'm super excited to have the reproductive psychiatry program here. So, what I have noticed in my practice, just a person here and also somebody who worked in other places in LA before coming here, is that there are not a lot of reproductive psychiatrists and a lot of OBs who are trying to manage people, and they just really are having a lot of trouble doing that. And so having a place that accepts insurance, which is great, where people can come. So the goal of the program is to have not just myself, but other great providers within Mindful Health Solutions who feel comfortable with this population and are learning the most up-to-date research. And we're meeting regularly to make sure that the patients who do come and seek services, we're all providing the really same high level of care to them. So if you come and you call Mindful Health Solutions and you're like, I'd like to be seen by one of the reproductive psychiatry providers, then you know that we're all talking together, we're communicating, and we're really making sure that we're giving you the best treatment on the case. So with that, and also part of the program I want to do is to make sure I'm doing a lot of education for other providers across Mindful Health Solutions, across, the city and state, whatever, whoever needs information, we want to be supportive of that. Also working in training with some residents and their residents in training so that more psychiatrists coming out of the pipeline will feel more comfortable in this area.
Yeah, that's great. It's such a great program, and it's so exciting to think that more people are going to be able to, understand this sort of thing and be
Mhm.
in a community that like knows what's going on.
Yeah,
So,
exactly.
as my final question, it's a more personal question. What is your favorite part about being a psychiatrist and working with people? Like, what really makes you passionate about what you do?
Mhm. It's just amazing how you really get to be a part of people's lives and kind of like see how their lives change. I think the favorite part, who doesn't love like being um, thanked for, is like when somebody is getting better and they feel like their antidepressant is helping and their mood is stable, and they tell me like, thank you so much, Dr. Bamgbose. I really appreciate everything you've done. So I love that. And I think what I love about reproductive psychiatry is I get to work a lot with pregnant people and postpartum. And so getting to meet babies virtually is really fun. And I think I've had a couple of times where um, my patient just had a baby and did their session from the hospital room after having a
Oh
baby,
my
and they just
gosh.
wanted to show me their newborn. And so I just felt so honored about that, that like,
Mhm.
this is a big day and you thought of me. So,
Yeah, that's so
so I
cute.
think, yeah, so I think having those moments where you get to really connect with patients, that's what makes it worthwhile and fun to do every day.
Yeah, that's a great answer.
Thank you.
Thank you. Thank you so much for talking to me today. This was really great. Is there anything else that you would want to add on the end for anyone watching and learning about this?
Um, PMDD is not in your head. So definitely if you think there's something wrong, you know your body the best and you know yourself the best. So probably something is wrong. So I say it's really important to find somebody who you feel like is listening to you, that you can connect with, that you feel like you can trust, so that together you can work at figuring out what is wrong.
Perfect.
Yeah.
Thank you so much.